Hi and good morning, sir. How may I help you?
Hi, Doc. Yes, I would like to seek for consult regarding my grandmother.
Sure, what about him that I can help?
My grandmother has always been loving and caring, especially to our family. She still cooks and even insists on doing household chores even though we ask her to rest. To most people, she's known as a kind and calm person, yet lately she has been exhibiting aggression and irritability, especially to the persons around her. She gets easily tired and easily annoyed even to small matters.
May I know what kind of matters does she get easily irritated?
Before, my grandmother is known for her long patience. Now, there are sudden outbursts of anger whenever things don't get the way she wanted. For example, we have a small kid inside the house and he often plays with his toys. My grandmother gets easily irritated whenever the toys are scattered across our living room, something that she isn't acting before.
Is there anything else she is exhibiting towards you and your family?
Yes, Doc. Aside from getting annoyed easily, she also seems to get anxious easily and is often observed as silent and sort of look like depressed before she is energetic and socially active.
Has she been taking any medications, or is there a sudden trauma that happened within your family?
None so far.
So what you have mentioned are indeed behavioral problems. As much as I want to immediately provide a diagnosis, I have to examine or interview your grandmother first. Yet what I can offer you right now are pieces of advice to at least help you and your family. For one, behavioral changes are indeed commonly observed in the elderly for a wide range of reasons. It may be due to body disturbance, the way they look at their body, which is gradually changing, or may also be due to weakening of their bodies due to physical limitations. It may also be due to emotional changes, such as when they have inadequate rest or stress. In worst cases, it may be due to cognitive decline and is leading to dementia. Nevertheless, whatever reason may be, your grandmother deserves the love and respect.
Yes, Doc.
So right now, these are the most important reminders that you have to bear in mind. First, be gentle in dealing with your grandmother. Do not escalate the situation by shouting. Second, do not be passive. Respond but in a calm and gentle manner. Third, acknowledge their concerns, and if they are scared, assure that they are safe and you will help them through the experience. And lastly, bond as much as possible. Eat with your family, go outside, and then spend quality time together.
I will take note of all of this, Doc, and I will make an appointment and bring my grandmother for a physical checkup maybe next week, Doc.
Sure, sir. For the meantime, we have here videos that can help you deal with this situation. It includes the causes and ways that you can adopt to manage your situation. You may watch it during your available time.
Thank you, Doc. I will watch it during my available time. Goodbye and see you soon.
Greetings, this is Lorma Clinic. This video tackles the behavior and stress management for older adults. What is behavior management for seniors? Behavior management is a special care short-term treatment designed to modify the severe behavioral disturbances of some forms of dementia and cognitive disorders, such as combative, disruptive, and disturbing conduct.
What are the causes? The causes of behavioral changes are a combination of things. Behavior and personality changes sometimes naturally occur with age, although such changes are usually gradual and not much reason for concern. They may be due to medication side effects, early signs of dementia, vision, and hearing changes, unresolved concerns or fears, or loneliness. In behavior management, you have to remember these things. First, reassure the elderly. The elderly can't change the way they are. You must alter both your response and the environment or situation. Reassurance reduces stress, upset, and other negative emotions. To reassure them, offer words of encouragement, and lend an ear. Second, know the possible causes. Upsetting behaviors are seldom done on purpose or to spite you or annoy you. Approach the elderly and gently ask them if they are going through something. You may also ask them what are they worried about or if something is causing them discomfort. Third, eliminate any triggers or redirect behavior or attention. By eliminating what sets off a behavior, you might be able to stop it. To redirect means to change the direction of things. Your goal is to move away from the stressful thing and toward calm. Some ways to redirect include spending time with the person, shifting to an entirely different kind of activity, or storytelling toward a cheerful past. Lastly, review what happened. Try keeping a written log of incidents. Jot down what happened, the time of day, anything unusual you remember about what was going on, and what seemed to help. You think you remember, but in the stress of everyday care, incidents run together. You'll be better able to track patterns. Having a record of frequency is also helpful if you need to involve medical help.
Good morning, Mrs. Johnson. How are you feeling today? I'm here to administer your medications. What's wrong? I can see that you're upset. I am here if you need any assistance. Would you like to tell me why so I could help? The other nurses promised me my favorite juice yesterday in exchange for taking my medication, but she has given me none. I will never take my medications again. I see. What flavor of juice is your favorite, Mrs. Johnson? I really like oranges since I was a kid, so I was very looking forward to it. It upsets me that the nurse lied to me. Ooh, I can see why you like oranges. They have nice, vibrant colors. Don't you think so, Mrs. Johnson? Why, yes, that's why I have plenty of clothes in its shade. Are all of them orange? I have some in other colors too. I would love to have a glimpse of those. Would you show me?
Anger. If the elderly exhibits rage, anger, and yelling, these are the things that you can do. First, try identifying the root cause of the anger, as the aging process is not easy for most seniors and can spark resentment in people living with chronic pain or struggling with other issues. Many people see getting older as a constant loss. It can mean loss of dignity, friends, mobility, and overall independence. They may experience memory issues or live with chronic pain. Consider the following possibilities: A. Depression. B. Fear. C. A need to control an aspect of their lives. Second, focus on positive behaviors. It is always best, though often difficult, not to take any behavior personally, especially in those with some form of dementia. Third, set boundaries. This is done by responding to positive behavior and ignore to the extent possible bad behaviors. Fourth, if they are resisting help in personal hygiene like showering, changing clothes, and brushing teeth, recognize that behaviors are often linked to a combination of depression and control. Older people sometimes feel that they have less and less control over their lives, and they begin to take stands on issues that they can control, and resist attempts to help them.
No, I hate this.
What is wrong, Mrs. Lauren?
My feet is tired. You can't make me do my daily exercises anymore.
You have been doing good, Mrs. Lauren. It is nice that you could recognize and express your feelings. Do you want to have a rest first before doing our exercise? I can wait until you are ready.
Stress. On the other hand, let's talk about stress. The common causes of stress may be due to deteriorating health, increased dependence on others, losing energy, or losing the ability to do their favorite things. It also includes loneliness and isolation and lack of purpose. Meanwhile, the signs and symptoms in older adults include sleeplessness, irritability, unnecessary worrying, feeling out of control, poor concentration, and frequent crying. If unnoticed and left untreated, it may lead to complications such as lowered immune system, heart problems, and emotional disturbances.
If the elderly exhibit stress, these are the things that you can do. First, encourage older patients in engaging in physical activities to elevate their mood, such as walking, yoga, chair exercises, swimming, aerobics, stretching, or cycling. Engaging in routine physical activity is one of the interventions an elder can do to relieve their stress. Second, provide them with relaxation exercises. Encourage them to do deep breathing exercises or meditations. You may also allow elders to go outside and be with the nature to reduce physical and psychological stress. Examples of these are nature walking and gardening. Third, involve older patients in music and arts activities and pet-assisted therapy. Even without any kind of musical or artistic background, creative hobbies or activities can help with the management of stress in elders. Art activities like drawing, painting, knitting, and jewelry making can help with stress as well. Lastly, encourage self-monitoring. The objectives of self-monitoring are to make older people more anxious of their thoughts and emotions, as well as to spot circumstances that make them feel stressed or anxious. Encourage the person to keep a record of the times the elders feel anxious or stressed by recording the time, situation, as well as any feelings, thinking, or emotions that they experience.
Occasional stress and tension is normal. However, chronic stress, anxiety, and behavior changes are abnormal. If the older person feels so overloaded by stress that it impacts his or her mental health, there is a need to address the issue. Ultimately, as families, we want the best care for our elderly. Always remember, identify the cause, be with them, lend an ear, extend your patience, be gentle, and sympathize. Thank you, and we hope you learned something from the informative video.